on multiple occasions. We've set aside some time at the end of our discussion for questions, and you can place them in the Q&A function on YouTube, and we'll be monitoring that as well. So, Kee, I think the first thing I'd like to start off with is we've talked before about how North Korea has largely taken and seemed with its border measures to essentially keep at least a massive outbreak of COVID out. But last month, North Korea reported its first official case of COVID-19, and it's been rapidly spreading, or at least North Korea said that there's been a rapidly spreading fever throughout the country. What do you make of this?
Well, there's a lot to unpack there, Troy. But first, let me just thank you for inviting me. I always enjoy these conversations with you. And, you, of course, are one of the experts as well. But let's just talk about, North Korea, how they're monitoring the outbreak and how they chose to follow up the fever cases, right? Because they don't have sufficient testing capacity to deal with the outbreak at this scale. And so what are the problems with using fever as a proxy? There are other things besides COVID that causes fevers, diarrheal diseases, other infectious diseases. And not all COVID cases present with fevers or let alone any symptoms. So there are some big issues with that, and you have to take that into consideration. But the fact is, if I'm sitting in the Ministry of Public Health in North Korea and I want to track the epidemic, the outbreak, I would use fever as well. It's sort of the best that they have to go with. What's concerning is that the outbreak seems to be nationwide, and it was incredibly wide, rapid increase early on in mid-May. What's been, what we've been seeing though is that it doesn't seem to have overwhelmed North Korea's health system, at least according to the number of deaths that they're reporting, which is probably in 2 digits, like 70 plus cases. So if we take that at face value, what does that mean? It just means that not that many people are getting sick or seriously ill or dying from this outbreak.
Yeah, that was an amazing thing. I remember exactly, I think the number that's been reported is that North Korea's had 0.0002% deaths or something like that, which is just, it seems more like a rounding error, if even that, than an actual death total, given what everyone else has experienced.
Yeah, I mean, how do you interpret that? So one way to look at it is, are they, counting only deaths that have been confirmed by, let's say, PCR tests, right? But if that's the case, then they're way undercounting. But that could be one reason. We don't know. But the other one is, is this accurate? Are there, is North Korea population different in some ways, and there haven't been that many populations that have had Omicron come in as the sort of the first strain, and ran through a country. And is this what you will see in real life in other countries too, if you had a similar type of scenario?
They might end up having been fortunate in this sense that Omicron is one of the least deadly, versions of COVID.
Right.
Information with North Korea is always a challenge. But to the best of our understanding, as I mentioned, they had largely kept, even if there were COVID cases in North Korea beforehand, which there likely probably were, to a minimal level. In most populations where there's a more significant level of infections or vaccinations, we've seen, relatively mild responses. Now the Omicron variant spreading in North Korea, I'm kind of curious your take, and you kind of led into this with your last comment, but it's an unvaccinated population without prior infections. Could they, setting aside whether their data is right, be facing a more serious challenge than, a population that was already vaccinated and had prior infections?
Yeah, so let's talk about what we have, what we would have predicted, right, given their population, which we know is significantly food insecure. They're subject to high levels of opportunistic infections like tuberculosis. That's a fact. On top of that, they're immunologically naive, right? The population has never seen COVID before, and nobody's vaccinated. So then, using those numbers, we expect the worst, right? And then and treatment capabilities probably aren't sort of not robust at best. But what we're seeing is something totally different. And so question is, how is this a realistic scenario that they're actually seeing so few deaths? And I will bring the example of some of the African countries, Malawi, Tanzania, South Africa, Madagascar, where it looks like they have reached endemic status, right? Herd immunity with majority of the population with antibodies to the COVID virus, without having gone through a major vaccination campaign. Like Malawi, as of January, I think 5% of the population was vaccinated. So, but over 80% of the population had antibodies to COVID. So so clearly the population was infected at some point. It didn't overwhelm the health system, and now they're pretty much open for business. So could this be the path that North Korea is taking? Where the virus becomes endemic, it's probably going to be treated as something like a flu. Maybe it doesn't look like it was as deadly as even at the flu at this point. So this could be a path for North Korea to reopen, and put this COVID behind them. But the problem, I think we're going to get to this a little bit later, is that we don't know what the future lies in terms of new variants, whether they're developing inside North Korea or even in China, which has yet to see a major outbreak.
Yeah, and maybe let's, since we've raised it in the endemic factor, maybe let's, touch on that for a moment. My understanding of, and this is just from my reading, I'm clearly not a medical professional, is that, if it becomes endemic, we'll get new variants, and, you could go years where perhaps those are all very mild, but there is no certainty that this takes and, remains mild, that we could see, a very deadly variant emerge at some point in the future. Is there then a risk almost on North Korea's part of perhaps, saying, all right, well, Omicron's come through, we've taken, most of the population's got, natural, antibodies now, it's been exposed to it, but, then perhaps letting their guard down and, having a worse situation later, specifically because one of the things I was reading is that, and this was in the context of China, is that because China has followed the zero COVID policy, that they are not necessarily, I forget the exact term, but in essence, because they had been exposed to as many variants and as much, that they were basically, their immune systems weren't, I guess, as advanced is probably the best way I can describe it, as others. So, I mean, does North Korea run some type of risk along those lines?
Right. This is, I think, really the major question. What's going to happen next, right? As you correctly said, North Korea and China are two countries that have pursued zero COVID strategy. But as we talked about, there's it's predicated upon the hope that the pandemic will end. But it doesn't look like it's ending. In some countries in Africa, it's becoming endemic, where they're just learning to live with it. In which case, at some point, China will have to reopen and allow the population to be exposed. And then I think North Korea already is now exposed in a major way. So I think, the issue of the variants is very concerning, because the Chinese population is massive. There's a saying, a virus cannot mutate when it cannot replicate. Well, the converse is that as they replicate more and more, there's a higher risk of mutations occurring. But what we're hoping is, like the flu, which mutates all the time, it's predictable and doesn't go beyond some of this virulence, that we've come to expect from the flu. And hopefully that'll be the same case with the coronavirus. That's the key. It's the endemic nature of this pandemic, and I think that's the way where it's headed. And North Korea and China will have to figure out how to shift their zero COVID strategy to something that's more in line with reality.
Speaking of new variants and the opportunity for it to replicate, how should we think about North Korea in terms of the prospects for development of a new variant there?
So it needs to be monitored, right? So these cases need to be tested, confirmed, and the genetic sequence should be tested, and that's how you decide whether there's a new variant or not. My understanding is that North Korea is interested in understanding and monitoring the development of new variants. But the best way to do that is not a Lone Ranger approach. You really need to share that genetic sequence with others, compare notes. So I think this is one place where I think North Korea I would hope, would decide to cooperate with their neighbor, China, and also the WHO. I think this is, and I know WHO has reached out to North Korea. They haven't fully used their membership in the Southeast Asia Regional Office. I think there's an offer to help, and I hope the North Koreans accept that.
Yeah, no, my understanding, I think the WHO has sort of confirmed this, that they helped them develop a COVID test. So, hopefully this is something where we can kind of build deeper cooperation, because it's in everyone's interest, especially if a new, more deadly variant were to emerge in North Korea, to try and have some idea of what it looked like as soon as possible. You had mentioned earlier on, its own exposure to TB within North Korea and other, factors. One of the things that we often do to try and get a feel for how deadly COVID's really been is to look at the excess deaths. And, we've seen in the case of like South Korea and Japan, the excess deaths numbers are fairly low. And so that suggests that sort of they've done a fairly good job of, managing the pandemic. The United States and India have seen relatively large numbers of excess deaths. We're not likely going to get data on that from North Korea to get a feel for what it might look like there. But I am curious, because we do know that they've had these border controls in place. You and I have talked about the trade data before, and how that's sort of limited access to medicines and food. How should we think about the pandemic's impact more broadly, not this outbreak specifically, on the North Korean population who's suffering from other ailments?
No, that's a great question, Troy, and we may never know the true answer to that. But excess deaths, as you mentioned, are deaths that are not directly related to COVID. But if you look at the number of deaths, there are increases in all deaths that you cannot attribute only to the COVID deaths, and you see a rise in those deaths in other countries like U.S. as you mentioned. And there's no question that the people of North Korea and the health of the North Korean people has been impacted even before the pandemic. The sanctions were limiting their ability to care for their people. Then the pandemic hit, and multiple things happened at the same time. One is economy tanked. We know poverty increases or worsens the health status of the population, especially the poorest. External health went away. External assistance, humanitarian assistance, pretty much shut down to almost nothing. We also know that food became increasingly hard to come by, and I think that's a serious problem as they move forward now. Getting the proper amount of food back into North Korea, and then trade stop with North Korea with outside. So that includes medications that you've been following, and hospital and treat medical equipment and parts. So all those things add to a degradation of North Korea's health system and health status. So it remains to be seen, but I think intuitively, the population will take some sort of a hit from all this.
Looking at the trade data, it's sort of interesting how you do see this surge, or at least a relative surge during the first year of the pandemic for medical imports in North Korea. From Russia, they actually increase. From other countries, the decline is less than it is for other goods. So there was a clear sort of focus, especially when none of us really knew what was going on, and trying to sort of import things that they might need. And I think that's kind of borne out in the data. When we, though, think about this, we know in the last month, because the Chinese just released the most recent trade data, that, basically there have been no new imports of, either medications or equipment that might be useful to dealing with COVID. The Chinese have confirmed independently that the train service that had been restarted earlier this year has been shut because of the outbreak. Well, outbreaks on both sides of the border. So North Korea and China have both been following a zero COVID policy. So in that sense, this isn't necessarily surprising that this would happen. But how does this actually then, now that we know in theory that North Korea has, a relatively large outbreak, how does this impact their ability to take and deal with it now that they've sort of shut off their access to supplies when they perhaps most need them?
Yeah, this is a complicated question. Well, let's talk about what do we know so far. We know that North Korea has been prioritizing medical supplies, and so they would, when they shut the borders, one of the things that really took a hit is cargo, right? Import of goods. And they came to almost a trickle. But even during those trickles, they imported vaccines and medications. Although even then, it was below what they were bringing in prior to COVID, but they were still trying to prioritize that. And in January of this year, when they, sort of went from a trickle to it was a little bit more of a spigot that got turned on with the railroads reopening. One of the first things that they brought in were, medications, ventilators, and masks, and those kinds of things. I think it's kind of coincidental that they brought those in. I think it was just timing. That I don't think they were anticipating a major outbreak, but in some ways, it was smart that they did do that. I don't think no one really anticipated this kind of outbreak in April and May. But they were bringing medical goods at that point. The fact that it stopped right now, I don't know if it's a reflection of the fact that they have enough for now. Maybe it just remains to be seen in the next few months whether they resume or not. But I don't think we can interpret that as, they're no longer bringing in COVID supplies. I think it's too soon to tell.
And I think you may be right that if I had to guess, looking at the patterns in the trade data, I would say they probably were concerned that as they opened up more to China, that they could get an outbreak. And so they were preparing, because if you look at when different items were imported, they weren't all imported in the same month. And so that suggests to me that this was more an effort to sort of stock up on things rather than we have an outbreak. We're not going to tell the world yet, but we need to get stuff in.
Right. I agree. I think they were anticipating something. And now I think they could have done it earlier. They definitely put more emphasis and confidence on their ability to keep the virus out. But they just sort of, and that's why they didn't vaccinate their population and bring more things in. But it sounds like they were trying to catch up earlier this year.
So I want to turn in a moment to audience questions. I'm actually going to combine. Alexis Dutton has a question. And she would like to know, what is the best humanitarian aid? And I want to couple that with something else that I wanted to ask you, which is, if we look at North Korea right now, people will have to talk about, well, we need to vaccinate the population of North Korea. And I'm not going to say we shouldn't try to vaccinate the population of North Korea, but what are the things that they actually need the most right now at this point in time, be it either humanitarian aid or other things to deal with the pandemic?
No, a great question. So we can, first let's talk about items, right? I mean, we could talk about things like antivirals, like Paxlovid. It's in a country with a weak health system. It's anticipating a massive surge of COVID patients. That's a game changer, because these are just pills. It can be stored on shelves, taken by mouth. You don't need syringes or special refrigerators, and it can take something that could be potentially deadly to something that's like a common cold, right? It reduces the risk of severe disease or death by 90%. So I think this could it be very helpful to have a supply of Paxlovid. Additional testing equipment, I think, would be critical, because they're literally flying blind at the moment. And I would think that they want to know, which ones are actually COVID, which ones are not. And then, of course, we talked about the machines to help detect the new variants. I think they're very interested in acquiring that technology or the equipment to do that. And then I think food aid I think is critical. During lockdowns, people who are dependent on their livelihood to be outside, whatever what kind of work they do, they can't work, they can't get the food, they can't get the water or medicines. This is important to get that, make sure that food is provided. It sounds like though that the Pyongyang is reopening, despite the fact that there are still new cases of fever occurring each day, which I think points to a shift in North Korea's risk assessment. I don't think they're pursuing zero COVID like they used to anymore. I'm changing my topic a little bit during my answering, but I thought that was an important thing to touch on. Yeah.
Yeah, no, I mean, it's interesting that they are, at least like you said, in Pyongyang and maybe other places opening up. On the testing though, I'm curious, do you think it would be better to take, and since the WHO has in essence showed them how to make a test, make sure that they have the supplies they need to produce tests domestically, or do you think it's better to take and just send in tests from somewhere else? And I mean, maybe there's not much of a distinction there, but
yeah, so North Korea never has really embraced humanitarian assistance. Ever since 1990s during the Great Famine, when they actually seeked out humanitarian assistance. Ever since then, they don't like the idea of charity, because it goes against their Juche philosophy. They prefer more of developmental assistance and it's more of a solidarity approach. So anything that's framed as a humanitarian aid is something that they never really embraced. And it seems like over the last several years, less and less they've been receptive to this. Even with the pandemic, all the offers were just, they didn't accept any offers at all. And if anything, they would go and buy their own things. They're buying their own drugs, their own ventilators. Where the humanitarian aid idea is less appealing from the recipient side, North Korean side, and probably the window to offer and use that as a lever to, let's say, engage more with North Korea is becoming less and less likely. I think the better approach is to strengthen the relationship they have with the UN agencies, not so much the humanitarian part, but the technical partners in health like UNICEF and WHO, and bring them in as full members, which they are, and seek better cooperation at that level. And there's a mechanism for providing assistance through those channels. Those are not necessarily humanitarian, but they're just support for national pandemic response plans and those kinds of things.
Yeah, it's interesting you talk about how humanitarian aid is less appealing. There was a story from NK News about a year ago, maybe it was last fall, it's not quite a year ago, that North Korea was smuggling coal, but not for cash, but for pandemic supplies, which, obviously it's hard to verify these things, but would suggest on some level that you're right, that on some way they want to get this themselves rather than have it given to them. So there's a question from Donald Kirk, and I think this is something that we've kind of not necessarily addressed yet, but that is good to sort of get to, which is that basically, they said for 2 years they had no cases. Why do we trust their statistics now? And couldn't this all be, in essence, and I've seen there was a news story this morning suggesting that North Korea was about to declare victory to take and build support for Kim Jong-un. In other words, I think the essence of the question is how much of this can we take at face value, and how skeptical should we be of the numbers of North Korea?
Yeah, and as I said, I don't know. No one can verify this, but I tried to look at it from both sides of the coin, which is there are reasons to be skeptical. Those numbers are completely outliers, off the scale, right? But on the other hand, there are scenarios where this is not a completely absurd, situation where countries have had infections with COVID and it barely registered anything on their health system. There was an infection that was passed on to other people and created antibodies without a major load on the health system. So which one's happening in North Korea? I don't know. Yeah.
Yeah. So I have one other question for you that I'm curious about. We've talked about cooperation with North Korea, the window may be closing. Clearly, as I mentioned, and you mentioned yourself, there's a vested interest in the genetic sequencing of different strains of COVID as they develop in North Korea. This requires testing and other things. How much of an opportunity do you see there for real collaboration with North Korea, be it either through the UN or on a bilateral basis with other countries? I've often thought that perhaps, working with South Africa on genetic testing, because clearly they're at the forefront of this and not necessarily a party to the other issues on the peninsula. Might be an opportunity, but sort of what do you see as the prospects for, that type of cooperation?
Yeah, so I think the humanitarian space is closing. Maybe never reopen. We're not sure, right? But definitely, it's gotten much more smaller, and their appetite for receiving that is almost, I think, gone now. But I think there's a huge motivation on North Korea's part to actually acquire health cooperation, health development, and medical, assistance. When it's framed as a developmental and capacity building, type of assistance, right? More of a solidarity. How do we help you develop your own vaccines? How do we help you manufacture your own vaccines and things like that? How do you, build up your epidemiological technical capacity? I think that's something that North Korea might not feel very strong about. Right, they don't have a school of public health in North Korea, so all those areas I think are places where we can be partners with North Korea and engage with them at an equal level, like we would any other country. And I think there's an opportunity there. Like as I said, the WHO has had multiple projects inside North Korea, successful ones. There was a project to strengthen maternal and child health over a 10-year period. It's almost $60 million worth of assistance. A lot of that came from South Korea. Actually, most of it came from South Korea. It's the largest health cooperation project, but it was mediated through WHO. It's a WHO project, basically. And it improved a lot of the county level hospitals, did a lot of training for North Korean doctors overseas. It created the telemedicine system, which to this day that they're using. So there are areas I think they're interested in, but it should be in line with their own priorities. The national, they develop a medium-term strategic plan for the health sector. It should be in line with that.
Yeah, I think this is sort of the challenge is that one, any type of engagement is going to require some type of buy-in on the North Korean side. And so on the one hand, we need to figure out what is feasible for us to do, but at the same time, we also need to be looking at like what are the North Koreans themselves looking for, because it's human nature. If you offer someone something that they're not interested in, they're not going to end up taking it. But before we go, I do want to get your thoughts. Sort of, clearly this is a situation the North Koreans haven't reopened their border. We've talked about maybe this is a path to like doing that. But what do you really think is the key thing we should all be focused on in terms of, one, trying to, because we should be clear that there are issues we have with their nuclear program, then there's the issue of a health situation within the country that's impacting everyone else around the world. But if you could just say, like, what is the one thing that, be it either the UN or the United States, South Korea, or others should like focus on in really trying to deal with this specific crisis, what would it be?
So, we were just on a different meeting just prior to this, Troy. It is organized by a different organization, totally different organization. But the topic was sanctions, right? And, the last 5 sanctions that were passed at the UN Security Council were designed to really hurt the civilian economy sector, right? These are economic sanctions, exports. Listen, North Korea is spending their own money to buy medicines for their people. The idea that they have abandoned their people is completely absurd. They're spending very, very precious resources on buying ventilators, masks, and drugs. Let's give them some breathing room. at least help them trade so that they can buy these things for their people. Right now, they can't export anything legally, right? The top three export sectors are completely blocked.
Yeah, most of the key exports are. Yeah, there's some things, but yeah.
Yeah, I would love to see the international community at least allow the civilian economy to recover so that it can continue to pay for these things. They're doing it anyway. And right now they have no way to make money legally to pay for
I think legally is the key challenge, because I actually think that they've paid for most things over the last 2 years with stolen cryptocurrency. But that's a topic for another conversation, perhaps.
And that's all the main reason to give them a way to trade legally, right, and make money legally. Yeah.
Well, Kee, I want to thank you again. This has been a great conversation. This is clearly an important topic, and something that not just the United States and South Korea, but the international community, because it's not a question of how we've helped North Korea. I mean, I don't know that we've all handled the pandemic globally well either, but it's something that I think is important to keep attention on. And now that North Korea has at least acknowledged, that the pandemic does exist there, hopefully that can create more space for us to try and work with the North Koreans to resolve this.
I hope so. Thanks for having me, Troy. I enjoyed it.
Thank you.